This is Sonia coming to you with another issue of Living with Chronic Illness. And today is a more serious topic that I wanted to discuss with you guys. And we're going to get really honest today. What I read New Mobility magazine, and it's very interesting. It has a lot of great articles about what it's like to live life using a wheelchair. I'm sorry, my voice is a little different today. And I come across this great article, and it says controlling opioids, controlling your opioids rather, so they don't control you. And as you see, there's a picture of a man in a wheelchair, and he has this pit bull on the leash, or bulldog rather, and he's wearing a little shirt called Narcotics. And I read this article in depth, and I actually took a lot of notes, because when you are dealing with issues such as using opiates for pain relief, you have to get honest with yourself. I'll ask you a question. Am I in pain right now? Can you tell? Am I looking at me by my mannerisms, the way I'm speaking? If you can give my pain a level from 1 to 10, 1 being no pain at all to 10 being the worst possible pain you can imagine. And if you say 10, you'd probably be wrong. But, okay, you ready? If you were to say 6, you would be correct. Can you tell if I'm addicted? For those of you that watch my videos, you know I take a certain opiate every day, the morphine. Am I addicted? Do I look like a person who could be addicted? Think about it. And the answer to that question is no. And I had to do some thinking about that, because it comes across our minds. And people think addicts look a certain way, act a certain way, and do certain things. And while, look, you cannot tell if a person is addicted to drugs by looking at them all the time. It's just, you'll be wrong. There are women that are grandmothers that are addicted to drugs. Actually, they have made drugs, the technology has made it very difficult to actually abuse certain drugs like OxyContin. And it's the way that they made it where it's hard to snort and ingest. What did that do? If you answered the question that it sent people to use another drugs such as street drugs like heroin, you're on the money today. That is correct. It didn't stop people from using drugs. It just changed the drug that they use. And heroin is a lot cheaper. So pain isn't going to go away. Your pain is, even if your doctor gave you all the opiates that you wanted and it fulfilled your every wish, if you are truly in pain and you are taking drugs to relieve your pain, then nothing's going to change that. Your doctors are basically, if they give you everything that you asked for, it won't change the fact that you're going to wake up in some pain. So, even with the pain medications that you have been prescribed, I'm sorry, your pain levels are probably going to hover around a 5 or a 6 on a good day like I am today. But that can easily change with my disease. In an hour or so, I could be in a lot more pain. So, the problem is no one's addressing the true issue. And the true issue that many people are being undertreated for pain. And so some people are so not educated about the drugs that the doctors are giving them that they're causing themselves a lot more problems than they need to be. You don't want to be like that picture where the guy's being led around, you know, and having the drugs that the doctor prescribed for him take over his life. You want to be able to control your life, yourself. I can't find the picture, but and I have some simple ways to do that. First of all, you have to be honest with yourself. Do you have an addictive personality? Before your doctor even prescribes that medication, do you have an addictive personality? Because if you do, a doctor handing you over a prescription for opiates could spell trouble. I mean, let's keep it real. If you don't really have an addictive personality, and if you have true pain that needs to be treated, the chances are you getting addicted to drugs, the drugs your doctor gives you, are slim. I don't care what they say. I don't care what intervention, you find yourself, you think your family is going to do an intervention any minute now. They're going to come running in with cameras and someone's going to take your drugs. That doesn't necessarily have to happen. But people take their drugs, their painkillers very quietly. But there's another group of people that's making a loud statement in this country. And that statement is that they're dying off like flies. Prescription overdoses are almost overtaking heart attacks and car accidents as the main cause of death for adults in this country. And it affects all age ranges from teen to people at the end of their life. And it's a serious issue. If you are using drugs to cope with an emotional problem, you're not helping your emotional problem. You need help. And we're not honest with ourselves in this country because instead of getting people the help that they need, we're criminalizing everything. We're throwing people in jail, and we need to treat drug addicts as if they have a medical condition, which they do. Addiction. We know more about addiction than we did 20 years ago. And we know that we need to start treating people instead of criminalizing them and putting them in jail to where they can still have access to drugs. And they come out and they do the same thing, and they'll do the same behavior that led them there. If we let out all the drug addicts in all the jails across this country, there would be a lot of empty cells. And that's the honest to God truth. We need to start treating addicts and not just criminalizing. Now back to my side and the people that pretty much watch my videos on our side of the barrel is that, a lot of us are in pain. And how we deal with that is that sometimes we think that addiction equals tolerance. No. You take an opiate. I'm not going to lie. It gives you a feeling of euphoria. A lot of people like that feeling. But what happens is your body is going to want to crave more of that feeling. So your body is actually going to start creating more pain to get that drug. That is called tolerance. And when your tolerance starts to build, what do? You take more and more and more drugs to get the pain relief. And some people take more and more drugs to get that euphoria. Because after a while, that dose that you take, that your doctor gave you, is not going to work. You're going to have to slowly raise the amount. And there's certain things that you can do to stop that. You can, seek help early. If you find yourself, tolerance happens to everybody. Everybody. Doesn't mean that you did something wrong. It happens to everybody. Again, you can develop a tolerance to any medication that you are prescribed. Learn how to control your levels. Learn how to, if you find yourself using just because you're bored, and if you find yourself using because something happened to you today and you want to be able to go to sleep, you're abusing your drug, and it's time for you to be honest with yourself and identify that behavior before it gets out of hand. Recognize those signs, and it's key. If you find yourself getting to a high level where you're taking more and more and more, you're going to get to the point where your levels are going to be so high that you need to control your pain relief that you're going to start running out of your drug. And guess what? You start running out of your drug earlier than the 30 days that your doctor gives you, they're going to start looking at you as if you're an addict. And that has to stop. That means you have to put yourself on self-imposed drug holidays. Self-imposed drug holidays. Meaning you want to kind of withdraw slowly. You want to withdraw slowly, and in doing so, you're going to save yourself a lot of troubles in the end. Now you want to let your doctor know that you're doing this, that you're slowly coming down on your drug, and only on days that you're gonna, once you start to take down that dose, you're gonna go through some withdrawal, and it's gonna be uncomfortable. I'm letting you know, but it's important because some people that are in our situation are gonna have to take drugs for a very long time, some for the rest of their life. If you're young, that could spell trouble for you, because that means that, you know, over the course of your life, you're going to be, I mean, come on. The medication isn't going to work for that long. So therefore, you have to be diligent in imposing these short holidays where you don't, you know, or you lower your dosage all the way until it's low, and then you slowly build back up again. Now, if you went from 100 milligrams and within a week or so you got back down to 15, and then 2 weeks from now you try to go up to 120 milligrams, you could have a problem, especially if 120 milligrams is a lethal dose, okay? So you got to be smart. You just can't go from a 15 milligram dose every day and jump back up there because that's where you used to be before. No, I'm telling you, you're going to be high out of your mind, and if you're at levels, depending on what drug it is, if that's close to a lethal level, you're playing with danger, which is why a doctor should always be notified when you decide to go on a drug holiday and taper your dose to probably nothing at all. And if you can deal with a Tylenol or an ibuprofen, go for it. It's better than being a slave to a drug, being handcuffed to this drug and saying that the drug is leading you and it's changing your life instead of you changing your life. Be honest with yourself. Be honest with yourself. And know that you're not a bad person. It's not a bad thing if you need pain medication. It's a fact of life for people who are chronically ill. But if you find things spiraling out of control, which they can do, don't be afraid to ask for help. But it is hard because you have doctors who they just don't understand. You know, they throw these scripts at you and say, hey, here, take this, take that, and you'll be out of pain. And the minute you say, okay, there may be a problem, they want to snatch you off the drug. You're sitting there trying to cope with Tylenol and over-the-counter drugs. That's not the right thing to do either. And that's where doctors and patients have to come together, and doctors must become more informed about their patients taking pain medication instead of listening to these alarmist programs, these news programs that say, hey, you know, you're going to get your DEA license swiped if you give out these drugs and that, and you shouldn't give them to anybody except the people that have cancer. Nonsense, 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 nonsense. That's why it's important that you choose doctors that know what they're doing, and that, you know, before they give you these pills, they know who they're dealing with. And it's important that you know who you're dealing with in yourself. Because if you're not honest with yourself, you're going to find yourself like that picture I just showed you. You know, that bulldog. And he's going to lead you around. And it's going to control your life. You're going to be chained to a drug that you need. Emotionally and physically. Because your body's going to crave it. You're going to crave it. And you're going to get to a point where your body just won't make enough natural pain medication of its own. It's like your pain endorphins, they went on vacation. And you're stuck, you know, not able to do it on your own, to the point where the medication won't even have an effect anymore because you've taken it for so long, and you didn't get help when you saw the signs sooner. So on that note, I'm going to say goodbye. I would like you to subscribe. If you have questions, we can continue the discussion in the comments. But however, I won't entertain people that want to prescribe medications for me. I won't entertain those who want to tell me what type of medication I should be on. And I won't entertain those people who say, oh, well, if you want to use pain medications recreationally, then you should be able to do that. You're part of the problem. I actually had someone do that. And I want you to know, if you're watching this video and you feel that way, you're part of the problem. You need to seek help. Opiates are nothing to be played with. They can be beneficial. They get me out of my bed every day and into this chair to do this. Or they could end your life and you'll be another American statistic. And on that note,